is preparing live right now.
It's true.
All right, let's get started. Thank everybody for joining us on the Source Seeker Hour online. I'm your host, Baruti Carl Alexander. I'm the Source Seeker. This is a grand occasion. This is our second episode online. I appreciate everybody for joining us. The name of this show is Media and the Pandemic, Part 2. We had Part 1, and it was such an important discussion that we needed to do it again. There's a lot of information out there, and we're going to get right to it. But first, I would like to go and get introductions from everyone. I'm going to do a roll call and ask you to introduce yourself. We will start. Dr. Eccles, can you start for us?
Mr. Carl, 1 second. It doesn't look like you're live on Facebook under your resource page. Are you sure it's live?
Oh, I apologize, guys. It still says live preparing. It does still say live preparing. However, we can continue with our show, Jordan. We're going to continue with our show because it's recording. Okay?
Okay.
All right. Dr. Eccles, can you introduce yourself?
Great evening, everyone. I'm Dr. Sabrina Eccles Sampson. I am a family medicine doctor here in Houston, Texas. Years of experience, also emergency room physician. I own my own family medicine clinic called Butterfly Wellness. It's located in Stafford, Texas. So thank you so much for inviting me tonight.
Okay, thank you very much. Dr. Higgins, can you introduce yourself?
Hello, my name is Dr. Napoleon Higgins. I'm a psychiatrist in the Southeast Houston Clear Lake area, CEO of Global Health Psychiatry Private Practice.
Thank you very much, sir. Dr. Deepak, can you introduce yourself?
Sure. Thank you for having me on the show. I'm Dr. Deepak Katachi. I'm an optometric glaucoma specialist and an optometrist. I'm a holistic practitioner and I'm in private practice here in Houston, Texas. I'm also a yoga teacher at the Texas Yoga Institute. Thank you.
Thank you very much. Ms. Jennifer Kane, can you introduce yourself, please?
Yes, I'm Jennifer Kane. I own a private practice in the Southeast Clear Lake area as well, by the name of Dorn Counseling. I am a psychotherapist, licensed professional counselor, licensed chemical dependency counselor.
Thank you very much. Bishop George, can you tell them about yourself?
Hello, hi everybody. I'm Bishop George Sanders. I'm senior pastor of Greater Mount Carmel, the Church of Restoration, and I also serve as an anger resolution therapist here in the city of Houston.
Thank you very much, Bishop George. That's my partner and friend, y'all, if y'all don't know. Thank you very much. I think we have our other people came back in. Dr. Wilson, are you there? I don't think she can hear me right now. Is there anybody else that we speak up now if you're there, everybody? Okay, well, we're going to get started with our show, Media and the Pandemic, Part 2. It's a big issue. It's the only issue going on at this time. Really, no baseball. No football, no concerts. It's causing a lot of mental health problems, very difficult. And the big issue is when will people start back in a normal way? The businesses are saying, hey, we're going out of business. We need to open up. The states are saying, hey, we need to open up. And, you know, the medical professionals are saying, hey, y'all hold up a second, because this can be very dangerous for everybody. I'm gonna take a second now and ask Dr. Wilson to introduce herself. How you doing, Dr. Wilson? Can you hear? Well, we'll get back to you in a second, ma'am. We'll get back to you. She's trying to get it together. What do you all believe? First, I want to ask this question. The medical professionals and people with experience, I've heard so many things about what are the symptoms. Some people say African Americans do not have symptoms. Then other people say you got to have a fever and a cough. Dr. Higgins, what have you heard about that? What are the symptoms of this coronavirus?
Well, I would like to defer that to Dr. Echo Sampson, but, essentially this coronavirus is, presenting in multiple different ways right now. Fever, cough, chills, the issues of elevated temperature, but also it's showing up in many other ways as well. And I think that with that, we may be missing a lot of it. Even in your young, recently they found rashes to occur with it. The issues of heart disease or even strokes, other gastrointestinal, so far as issues with nausea, vomiting, lack of appetite, frequent stools. So this coronavirus is presenting multiple different ways, and we have to pay attention to what's going on and realizing that any unexplained illness right now is something that you want to make sure that you at least check for coronavirus, especially in persons who are developing new symptoms.
Okay, thank you very much. Last time we talked about the immune system. Dr. Deepak was talking about that the real concern is the immune system, not as much the coronavirus, but making sure we have a strong immune system. I'm gonna get back to your comment on that, Dr. Deepak, but I wanted to ask Dr. Echols about what is she seeing in these symptoms, and what about the comment that some African Americans or African American men do not have symptoms but still have the disease? Dr. Echols?
Right, I have seen, yes, yes, I have taken care of people with the coronavirus with various symptoms, just like Dr. Higgins was saying. I won't repeat everything he was saying, but I mean, everything he said was right. People are coming in with different types of symptoms. Some are very fatigued and no fever, and some have fever and cough. And lately we've been seeing people with rashes, maybe a cough, fever, and then a rash on their body extremities. I've seen people with GI symptoms. And so like you were saying,
what are GI symptoms?
That is not true. GI, like the diarrhea,
okay.
Nausea, vomit, loss of appetite, and frequent stools. But when you hear the African Americans say, well, I won't get this, or, we're not seeing it in men, that's not true. Because we are the largest minority that is affected by the coronavirus across the country. We have the largest amount of minority of deaths, the African American, because of underlying conditions such as diabetes, high blood pressure, asthma, COPD, coronary artery disease. So, and we're seeing more of our people die of the coronavirus. So that's not true that African American men may not have symptoms, but that's a variety of symptoms that people display. For when I work in the emergency room, we suspect everybody has it until proven otherwise. And so in our mindset, we treat everybody the same, and we treat them like they may have have it until we prove otherwise through testing. And so every symptom, like one lady came in and she just had a cough and symptoms of a bladder infection. Well, we tested her for coronavirus because we're seeing people that come in the hospital now for bladder infections and they had a coronavirus. So that's the thing. We don't want to miss anybody. We don't want to miss anybody. So we test everybody that we see that's coming in.
Thank you very much. Dr. Deepak, I'm gonna get back to you. I want to ask Ms. Kane about the mental aspects of what it's doing in the community. Last time, the destructive part of the mental aspect of people being so concerned about the coronavirus. What have you seen in that area?
Well, when I refer back to what you said earlier about the immune system, right? When we have anxieties, our body is in a hyperdrive because of the changes in this community, what we can do, access to things, financial restraints, all of those different things affect our immune system. That anxiety, those fears, those concerns and worries, and it depletes that immune system and makes it more difficult for us to fight off any disease or illness that normally would be fought off with our bodies, right? So I've been seeing with a lot of my clients that I have pre-existing prior to the coronavirus, they actually have been coping pretty well. Because I believe that anxiety hasn't really it's not new to them. This change in being able to accept the change, and it has been prevented in regards to the panic aspect. Now, I have quite a few new clients that I have been seeing, and that all regards their lack of control, which still regards the anxieties associated with the change and the significant amount of loss that we are experiencing, because we are all experiencing a significant amount of grief as well. Grief of those events that you were talking about. The baseball games and concerts, things that we usually are able to attend now all of a sudden are gone for a long extended time. So I think if we allow ourselves the ability to grieve, recognize how we feel, and find the things that we can control in that space, then we'll be able to cope with it and then adjust, and so that we can have a healthy immune system, and two, so that we can stay well mentally throughout this time.
I understand. I know it's a challenge though. I mean, because I have had to change. Just what we're doing right here has changed from what we used to do. So it's a whole adjustment that so many people have to make, and not everybody is making it very well, but we got to hold on and persevere and try to do better. Before I get to you, Dr. Deepak, I want to see Sister Dr. Manira Wilson. Are you available? We still can't hear you yet. Okay, turn your audio on. Dr. Deepak, can you come in on what you've heard so far and speak on that immune system that we were talking about last time?
Gina, I'm going to touch on a few sensitive points, right? One is the immune system isn't built in a day, but it starts with the first step, right? And the first step has to be your diet. To go back to the flip side of it, we were asking initially about, if African Americans do not get the virus. A lot of my patients have been asking me, well, do vegans and do vegetarians avoid getting a virus? And the answer is no. Unfortunately, the jump from getting a virus from eating contaminated food has already been made. It used to be, COVID used to be the zoonotic virus, but it has mutated and is now able to go human to human. So it doesn't matter what your race is, it doesn't matter what your diet is, this virus is an equal opportunity killer. Having said that, the immune system has to be boosted, right? everything starts with what you eat. So if you eat foods that will cause inflammation, such as fast food or sodas and diet sodas, or, you know, junk food, your immune system is going to be overwhelmed. It's not going to function as efficiently as it should. So diet becomes crucial. So eating a plant-based diet, a whole foods-based diet rather than processed food becomes important. So that's how you boost the immune system. The second thing is, a common factor amongst patients that succumb to COVID has been thought to be vitamin D deficiency. So vitamin D is best gotten by doing something outdoors, going for a walk. Going for a walk is also very therapeutic for the mind, for the psychology. So I advise my patients, you know, go for a walk, 45 minutes, fresh air, no music, no headphones, no phones, nothing, just you out in the nature as best as you can by yourself. Just do a brisk walk, get your heart rate up to a certain point, a nice brisk walk, and do it for 45 minutes. And that's going to produce some very beneficial hormones and some proteins. And if you do it by day, it's going to get you exposed to the sun. You don't want to do it between the hours of 11 a.m. necessarily to about 5 p.m. in Houston, because those rays are harmful. But if you go for an early morning walk, late evening walk, that's highly therapeutic, highly beneficial. And now if you go for a walk and you clear your mind, you're going to be able to sleep better as well. And so sleep is a huge factor in boosting the immune system. And so, you know, we've said your foundation of disease prevention is your immune system. So what you eat and how you react to your environment makes a huge difference. So stress is also best managed by doing something positive. You know, pick up a hobby, pick up an exercise, go for a walk, go for a bike ride, whatever it is that you enjoy, and build that immune system up, clear your mind, get a lot of self-satisfaction. It brings your blood pressure down. So there's a lot of therapeutic benefits here. And then the last thing I want to touch on as far as the immune system is don't underestimate the power of prayer. I'm on the board of the Institute for Spirituality and Health at the Texas Medical Center, ISH, and our partners there are all the major hospital systems in the medical system. And, you know, we have their medical students come over, that we have their doctors come over, we have a yoga center up there. And they've looked into studies, and, you know, and this is available everywhere now, where the studies have shown that the power of prayer actually is very protective. It affects your genetic code. It specifically elongates your telomeres at the end of your chromosomes. And so it's very protective, it's very therapeutic. So although prayer transcends biology, we have biological benefits. So when you look at the immune system, you have to look at the whole human being in total, in perspective. And so everything from what you eat to where you go ahead and pray before you get a good night's rest is essential.
I understand, I agree with that, but I would always like to interject this. There are a lot of people who don't have that kind of balance where they cannot just, for instance, not everybody can stay at home and do social distancing. Some have to go to work. Medical professionals have to go to work. And so that might give them a little bit more stress. And having to deal with all the other things dealing with the COVID-19 situation disrupts their lives a little bit. And so that's why that the mental aspect comes in, because they have to have the right mind to be able to do the things necessary, to eat right. They have to have the right mind to go and exercise, because you have to have the thought first to do the right thing. So that's why the mental aspect is so important, just like the medical part of it. Bishop George, how you doing, Bishop George? Bishop George, can you speak on how are your parishioners talking about the difficulties that are going on?
Well, I couldn't say it any better than Dr. Deepak. One thing that's going to really help us to get through this trying time right now is that we are really going to have to work on our spiritual aspect. Even as Dr. Deepak stated, we need to recognize, and I know that the medical community that's represented on tonight's broadcast, they will agree that the human itself is a multifaceted creature. Not only are we physical, but we're also mental, emotional, and spiritual. We're body, spirit, and soul. And there is proven research that states that meditation is very effective in sustaining and maintaining the immune system. So I've been stressing to all my parishioners to definitely be in a state of meditation, to make sure that they take at least an hour to 3 hours out of the day just to get in a quiet place and meditate. Because what's going on in society, we are social creatures. So when you put us in a situation where our daily walk or our daily routine has been compromised, it is going to come out in stress. And that's why you're seeing a big bump up in crime. That's why you're seeing a lot of domestic violence going on. And also being that I am in that field with CPS, we've been seeing a lot of child cases that are on the rise, where we have a lot of offenses against children that are taking place, where abuse is also taking place in the home. And that factor comes from the fact that our daily routines have been compromised. So it's very important that prayer and or meditation, however you want to put it, or whichever one you subscribe to, that is implemented in your daily program. As I talk with my parishioners, many of them are in the home. They are only restricted to going to the grocery store, not even going to doctor's appointments anymore. They're talking to their doctors on the phone. So life has changed, but all of them are saying the same thing, that those quiet moments where they're meditating and where they're looking at things from a positive lens, it's helping them to feel better. They're not in a hypochondriac stage where the moment someone sneezes or the moment they get an itch, they don't think that they have the coronavirus. They're going on with their daily activities. So I'm really excited about that the meditation and the prayers taking place. We really need it. As an anger resolution therapist, I subscribe that to all my clients, that meditation is a big part of the day.
Thank you, Bishop George. Super powerful. Dr. Wilson, are you available now?
I think so. Can you hear me now?
I can hear you now.
Yes.
Introduce yourself, Dr. Wilson.
Very good. Okay. So I am Deborah Wilson. I'm a LPC, and I teach clinical mental health at one of our local universities. And working from home is a challenge even for me. Sometimes we work a lot at home. We work more at home than we do when we're in the office. But in terms of the clients, I agree with Jennifer and the Reverend and everybody that I've talked to. I'm getting a lot of calls. The calls have increased from clients who are impacted by the coronavirus. The biggest thing is the change in the routine in general. But for African Americans specifically, there's a lot of stress and anxiety, first from the change in routine. Well, I'll say first because there were a lot, as Jennifer said, a lot of pre-existing conditions for us from a psychological and a socioeconomic perspective. And then the mental health impact from not being in the office and being able to gauge those co-workers who exert a lot of microaggressions upon us as African Americans. So the stress for a lot of clients that I'm getting in, while they say they're stressed out and, I don't know where this is coming from, it has a lot to do with them not being physically present in their workspace to gauge how they're doing. And so this creates a lot of stress for them. And they're seeking ways, and a lot of them are, well, let me say it like this: the coping skills that we had developed over time to deal with our environment, this coronavirus is way ahead of those coping skills. So as Jennifer said earlier, we have to develop different ways of dealing with our new quote unquote normal. And
Yes,
so
ma'am.
what
And that, go ahead. I mean,
Go ahead.
that is the challenge, because we all got used to doing things a certain way. We did the
Absolutely.
Source Seeker Hour in the studio. Now we're doing it online. That's a big change. And
Right.
it's an adjustment. And
Right.
everything has been adjusted
Right.
everywhere. And
Right.
it's a process that everybody has to get used to. And we're still
Right.
trying to get used to it. Let me ask
Right.
this question to everybody. They are talking about opening business back up. I think it's being opened back up here in Texas. Correct me on the date. But medical professionals are saying that's going to be dangerous. Let's go around the table, and what is your opinion? Dr. Eccles, what is your opinion on opening up and the possibilities and the damages? What is your opinion on that?
Well, you're definitely right. They're already starting to open up. The Texas, the Governor Abbott, he's already released the plans of opening in different phases. And I believe last week was the restaurants at 25% capacity. Tomorrow is barbershop salons and spas and things like that. The 18th is the gyms. And so I believe, I can't speak for everyone in the health care, but coming from my standpoint and what I've been seeing, I think is opening up too fast. And I agree with the doctor from Johns Hopkins who testified in Congress saying that there are 4 critical principles that you need to look at for each state on how they should open. And one is that they see over the last 14 days a decline, at least for 14 days, decline of new cases, say for 14 days. And so there were other criteria as far as testing and being prepared for PPEs and actually tracking new cases. And she said this, and this is really what really stuck with me. She said, no state has met all 4 criteria. No state has met all 4 criteria. And so World Health doctors and the World Health Organization and people that have been dealing with plagues and diseases for their whole entire career, they're saying that we're opening up too fast. We're opening.
Okay.
Yeah.
Okay, I understand. Dr. Higgins, but at the same time, people are going crazy. They're storming the capitals of their states with guns and so forth. And there's threats of violence. Somebody got shot just for asking somebody coming in the store to put on a mask. So, I mean, where do you draw the line? Where do you say, okay, we got to compromise? What do you feel on that, Dr. Higgins?
Well, me personally, it's a lot of different emotions and thoughts about what we're doing, realizing that as people, we're social creatures. So the thought that you can cut off one set of grapes off the vine and believe that the grapes are going to live is not going to work. So essentially, it has to come down to the initial response of what we could have done or should have done, and that people cannot sit for long and sit forever and be without jobs forever. So we kind of missed a lot out the gate. And now the question is, now that the gate's open, how do you close it? And I don't know if you are able to. And so the plan right now seems to be, well, we'll just let people die. that'll be what the people want at this particular point. And that's a very scary thing. You know, it did now as a Black American, it was quite odd to see that when they started saying that it was mostly affecting Black communities, it seemed like the next day it was like, well, we need to open up the government, as if it's not going to happen to them. And too often what will occur is that because the government has opened it, a person will believe that everything must be okay now. And the fact is that if we shut it down 3 or 4 weeks ago, the numbers in Houston are rising daily. We had a time where we had 4 days nobody in the city of Houston died of COVID. But as soon as we started talking about opening it up, the cases are now running up even faster. So the fact is that it's not time to take our foot off the brake at this point. But we've got to put the things in place so that the people we can open up the community and be healthy at the same time. And really that comes down to testing. Now, I don't know why it wasn't a set of mass testing, in that essentially if you've got antibodies or if you've never been exposed, then essentially the question is, do you need to be locked in? Now, if you do have the as we had talked about, some people don't have symptoms, but you could be a spreader of it. But if we tested people, they would know their status and they can make a decision according to the status, or even come up with the rule or even the law about, if you tested positive for COVID, no, you should not be at the barbershop cutting hair even with the mask on. All right. But it's our lack of planning, lack of direction that's really putting the people at risk, realizing that folk are not going to be able to stay cooped up forever. And because the virus kills a lot but slow, people don't believe it's going to be them. Right. And that puts people at risk by believing it won't be them, it will be somebody else.
So we still are very challenged as far as implementing a process that can be working and a process that is fair for everybody. It's still a great challenge. And I still go back to the mental aspect, because if our mind is not right, it doesn't matter what the rule is. If our mind is not right, I heard Leonard Pitts today. He said, it's not up to the governor, it's not up to the president, it's really up to us whether we're going to feel comfortable going out to participate in society. And that was a great point, because if people don't feel comfortable, they're not going to want to participate. And then there are other people who are just want to do everything and don't care about the risk. So we have a dilemma that we are trying to work through in every way that we can. Ms. Kane, the difficulty of the mental part, like with somebody, because you get asked to wear a mask, they get so upset where they go to violence. Where does that kind of mindset come from? Unmute your mic.
Here we go.
Okay.
So my favorite thing about that type of response in general is crisis causes change, and change causes crisis. They're all the same, they equal the same thing, but refusing to accept that change leads to suffering. And so I think the people that you're referring to are refusing to accept the change and are suffering internally. And so as soon as they have some interaction with another person, and you don't know what they're suffering with at home or what's going on in their internal world as well as their physical one inside where they reside, But I think that's a part of it. The fact that this change is difficult. I don't know where my finances are going to come from. I don't know how I'm going to take care of my kids. And then it's in the Black community, we don't know how to effectively cope with our emotions and our feelings, because we don't want to feel like we are inadequate or, placed in a spot where we're viewed in the stereotypical way. So, and then when we have these types of changes, we respond in some ways that are unhealthy. If we accept that change, because that key is refusing to accept it. right? So if we accept it, this is right now. This is not forever. It's temporary. It's not going to be the rest of our lives. This is our lives right now. So
I
if
think some of the changes will be here, though.
they will be.
I think some of the
Well,
changes will
we're not gonna stay stuck in the house.
gradually build into us and be permanent.
Yeah. It's going to be impactful. I'm not saying this isn't traumatic. I'm saying we are not, we'll one day be able to go back to a concert. One day we'll be able to have some sense of that normalcy. We might have to wear a mask while we do it, but we will have that sense of normalcy. So I'm saying accepting the place that we're in right now. If we accept that this is the place, it's not going to be a forever thing, that we're in this same place. And we have to make choices that are considerate of others while we do that. So if we consider how other people can be affected, because I think I don't have the virus, but I want to go somewhere, then let me be considerate enough to put a mask on and consider the other people, even though I think I don't have it. Maybe you can be an example, but if we accept it, accept that that's where we are, and we can do things to take care of ourselves and then be considerate enough for the community, we'll be able to get through it a little better.
Thank you very much. I mean, this is a bigger challenge than I can remember in my lifetime, even bigger than 911 in a lot of ways, which was kind of regional to New York area. But this is everywhere globally, and the uncertainty makes it so difficult. The uncertainty of what is going to happen. How is it going to change? How am I going to survive? What do you say, Dr. Deepak, about, are they opening business too early? Is it going to have a very damaging effect? Dr.
Well,
Deepak?
so I'm gonna take the opposite position, right? In one of the articles that I wrote, I said that the impact of this is gonna last for a long time, 18 to 24 months at least, until sufficient vaccines come on board and sufficient herd immunity comes on board. So we're looking at this long term. If we were to not open up America, there will be no America to go to. We're going to sink into chaos and anarchy. So we have a tough job, right? As decision makers, we for our families and so on, the governments for the cities and so forth. So for instance, in Harris County, the mayor's already said that, you know, stay at home until May the 20th. So where my business is, you know, we still have stay at home till May 20th, but you cannot not open the businesses. I think they're opening up a little too soon, but it is going to be prudent to maintain all the parameters that the CDC has laid out, the social distancing, the number of people, the occupancies, and so forth. You have to wear a mask. You cannot go back to business as usual. In fact, in my article, I say it's never going to be business as usual. This is a black swan event, kind of like the Spanish flu. It's going to change America forever, and it's going to change the world forever in certain ways. And so it's never going to go back the way it was. So it behooves us to start accepting this mentally, to start getting prepared for it, and to take all the prudent precautions to make sure that we protect us and our loved ones. We may be healthy, but we're going to bring it home to our parents or to our children.
Right.
And that's the danger, that's the fear. And so people that have a mindset that, hey, I don't need to wear a mask, to me, that's tantamount to manslaughter. Okay, it's like, and that perhaps might be thought of as excessive. They have a right to go do what they wish, but not in the presence of other people who may be compromised. And so in a social setting, I mean, you do what you wish in your house, but when you step out of the house, you have to follow community rules. We all have to. And so as healthcare providers, we have to follow CDC guidelines that have been laid out and say, okay, we have to maintain social distancing. We have to wash this. We have to wash our hands. And there's a correct way to wash your hands, and you have to do it for the 20 seconds and so forth. Everything that we've talked about does not go away when we start opening up. People are thinking, okay,
Absolutely.
we're opening up, so it must be safe. And it's not. That's the misnomer. So as long as we're following guidelines, that's all we can do, because we cannot stay closed for 2 years. That's just not going to happen.
I totally understand, but it's still a big challenge. As you said, the
Oh, yeah.
decision makers, even
Absolutely.
President Trump, one day he's saying one thing, one day he's saying another thing, and there's so much uncertainty and confusion, and that's affecting our mind, and that's affecting
Confusion and
our
fear.
understanding.
Here's the
It's a
problem.
very difficult process. Yes, Dr. Deepak.
See, here's the issue. This virus is an old virus that's come back in a new way. And so it has mutated. The first mutation allowed it to make the jump from animals to human, right? And the second mutation is now causing it to go from human to human. And so as it mutates, it's like trying to shoot a moving target. You're trying to bring a vaccine. So for instance, just this week, CDC is admitting, okay, that the COVID tests are not effective. They're not as sensitive as they need to be. They're not as accurate as they need to be. The antibody tests have been revised. Again, even this morning, the antibody tests have been revised. And so, it's a moving target. So the president on down can only work with the information that they have. And, I'm gonna go out on a limb here, and Dr. Fauci has done what he could, but Dr. Fauci may not be the best person for this. And that's gonna put me in a huge minority pretty quick. But Dr. Fauci served several presidents. He's not a Trump man. But there are things that, like I said, like last time, educating the public on better immunity has to be the #1 public health challenge. And treatment is the #2 public health challenge. But the treatment is months away, if not years away. Therefore, education has to be key. And as you
Right.
open up the business, as you open up America and America gets back to business, then this education becomes paramount. And when you are an informed consumer, then your mental status will immediately be better. If you know to do A, B, and Z, then you are going to be prepared and you're going to take care of you and your family without risking financial ruin. So yes, it is a challenge, but #2, there has to be a systematic way to go about dissipating this information, which unfortunately Fauci on down has not happened.
I understand. I want to take this second to speak on that. One of the ways that we are trying to educate is the Source Seeker Hour, with the changes, with the different modifications that we've had to go through. And there are ways to survive. We got to find new routines, as Sister Jennifer was saying. We got to find new routines and new ways to adapt. And we will get there, but it's going to be a difficult process as we go along that journey. Bishop George, do you have something to share with what we have been talking about, Bishop George?
Yes, sir, I most definitely do. And I guess that I can really say this, my sector, and what I mean the religious sector, may have been the sector that it was visibly hardest hit by what is going on with this coronavirus. I'm going to step out there and I'm gonna say that we're making a big mistake by opening up everything early. If you watch the news, if you've seen media, there have been more bishops, in particularly one denomination that I'm connected to, the Church of God in Christ, that have literally dropped like flies. I'm talking about there is one jurisdiction of the Church of God in Christ that they literally have to replace all their bishops because they died, because they refused to shut their churches down. And this was a big controversy in the religious community that many pastors, including myself, we were criticized because we refused to keep our churches open during this pandemic. And unfortunately, we use a lot of monikers. I'm just going to put a different twist on the show. You got so many people saying that if we serve God, then we're covered by the blood of Jesus and we're protected. And I just want everybody to know that that's not true. Now, personally, depending on my walk with God, I may be covered, with the blood of Jesus, but I can't speak that on everyone that's going to walk through the doors of my church. So what's going to happen is I'm walking around with my covered self, but I got 3 or 4 people that are in the congregation that are spreading the virus to everyone that's there. So pretty much I'm the petri dish for this coronavirus that's spreading. And what you're going to see, I've already predicted it, after the smoke clears, you're going to hear about a lot of churches, a lot of religious organizations that are going to be sued because they're going to be held culpable for the deaths of so many people. You've seen it. They've had choir rehearsals and half the choir ended up with the virus. Many died. Leaders passed the virus to their parishioners and they died. And they asked me, they said, when are you going to open your church? I said, I'm going to be honest with you. We may not open up to the year 2021 because I want to make sure that we got a handle on this thing because we don't want to be responsible for spreading it. And even myself, I know that on tomorrow, there are going to be a lot of people going out, getting haircuts, getting their nails done. I'm not going to be one of them because, I don't have the medical degrees that my colleagues have, but just looking with 2 good human eyes, I know that there is going to be a second wave from the cities around the United States being opened up. I don't want to be part of that second wave. I'm going to let them air it out, do what they need to do. But one thing that I want to say is that I agree with the medical community. There should be more testing. We should get a toehold on this virus. We do work toward a vaccine before we just completely and totally open up the city, especially our social settings, where it's going to be next to impossible for people not to speak, for people not to touch, for people not to share the same thing or spread germs. We just have to be careful in this season.
Yeah.
Yes, sir. We do have to be careful. I want to say, as a teacher, and speaking for the teachers, and having to work with students and other staff, and that's a big incubator. So
Right.
I hope that the governor and everybody else understands, because certainly if that runs through the educational system, there's going to be a lot of lawsuits. So I would encourage the state to say, okay, well, we may need to continue this virtual education for a little while longer. We're getting closer to the end of the show. I just want to say this is the Source Seeker Hour online. I'm your host, Baruti Carl Alexander. I've enjoyed everybody. We got a few more minutes, and I want those who have something to share. Go ahead, Sister Manera.
Can I just add that, them opening up things now will not cause the anxiety and the stress that individuals are experiencing, and all of the emotions that's attached to it will not dissipate overnight. And so I would just caution everybody just to be mindful, that's a term that's going around, of the fact that individuals are impacted by it from a standpoint of anxiety and stress. Am I gonna catch it? And so one of the things that I talk to my clients about a lot, who are fearful that they're going to catch it, that in the back of their mind, a lot of their fears are related to what's going on, what's going to happen to them on the other side of this. But just be cognizant of the fact that you're experiencing it. I don't care who it is. Some people depersonalize it like, well, I don't know anybody that has it or that has died, but nonetheless, it impacts us all. And so we need to be cognizant of the fact that other people are experiencing things. And so how we interact with one another is going to be really important as we transition out. Important from the standpoint that we not take somebody else's responses out there personally, and that, you don't know what somebody else is experiencing. So, just be cognizant of that. be responsible. If you've got high-risk children at home or elderly people in the house, you know, you are going to have to exercise judgment for the safety of yourself and your family and others, right? So just like they say, when you're driving, you have to not only look out for yourself and drive safe, but you have to look out for others, because you could be sitting at a red light and somebody will ram in the back of you. Well, that's something that you couldn't help. So this is
Yes,
the
ma'am.
same in terms of what you might be experiencing. Somebody, you don't know what the other person is experiencing. And so we need to be cognizant of that in terms of keeping ourselves safe as we go out there.
One thing I want to make sure about, Dr. Wilson, is you're saying that even if they lift all the restrictions tomorrow, people are still affected in their mind by what has already transpired.
Absolutely. They still
Okay.
think, well, am I going to catch it? Am I going to get it from you? Like you mentioned, the fight over the face mask. Well, whatever they were experiencing before Corona is exacerbated by Corona, which is way ahead again of our defense mechanisms or our coping skills. And so those of us who have the mental capacity and the calm to do it must be cognizant of the fact that there are others out there who may not have the coping skills to deal with the situation overall. And that is a part of our being safe, as well as we transition back to whatever the new normal is going to be.
Yes, ma'am. So we just got to be cognizant and careful, just even more so in this new environment. We're going to get ready to finish up. And as we do on the Source Seeker Hour online, share more in your ending statement about how you feel about the situation, as well as what do you see in the future. Miss Jennifer, Miss Kane, would you share that? And let us know how, if we want to get in touch with you, or somebody who's watching this wants to get in touch with you, how can they?
So I really take this as, because I think a lot of anxiety is how we see the future and what we try to predict sometimes. And so I think the only thing, and I know the only thing that we can always control is the moment. Mm-hmm. And if that's what we can control, that's what we can improve. And we can make some certain choices to make sure that we improve that moment. So I don't know. You like you've been saying so long, it's uncertain. We don't know what's going to be happening next week, next month. If even if the gyms are going to open, and things like they're going to open, because it's based on the number of cases. So we don't know that, but we know what we can do right now. And if we have health concerns, we can make some choices to stay at home and not get that haircut. That's gonna be me. We can choose to stay, protect our older family members and things like that by not going and thinking we don't have it and interacting with them and putting them at risk. We can make those choices, but we can always improve our moment. We cannot predict the future. And I think that's why we stress, we worry, we are overwhelmed by what's going to happen tomorrow. We don't know if we're going to have it, but we can do the best we can today. In regards to how to get in contact with me, I do have a website. That is the best way to contact me, at Adorned Counseling. So it's ADORNED counseling.com, which all my other contact information is there. I'm also on Psychology Today, so if you type my name there, it'll give you all access to my information. But I really just think that we just have to really do the best we can with the moment we have, and that's when we actually are mindful and are able to live life the best way we can. We don't know what tomorrow's going to bring.
Mm-hmm. Blessings. Thank you, Ms. Kane. Thank you very much for joining us. Dr. Higgins, can you share how people can get in touch with you, and a word on what do we believe the future is going to hold in this new environment?
Well, honestly, I believe that people have gotten restless. We missed our initial time when we had everyone's attention. The continual lack of a plan, I think, is going to be a very dangerous situation. out there. I do expect more increasing deaths in the way that we're doing it. And honestly, I don't believe it has to be done this way. I definitely believe that you can open up the economy and keep people safe. That is done through testing by knowing who has it, who doesn't have it, who has antibodies. Obviously, you could test them more than once with more than one test. If we did mass testing, if we knew people were safe and well, those people move around and do about and go to work. The lack of us doing so, I believe, is going to cause mass death. And honestly, it's happening more so in Black and brown communities. There's a lot of setup for that. And honestly, you have to ask the question, are we committing genocide once again in our nation?
Yes, sir. How can people get in touch with you, Dr. Higgins, if they choose to?
NapoleonHigginsMD.com.
All right. Thank you very much, sir.
How to stay safe. You can't stay safe during this period of time. I say duck down and stay low because it's coming.
Are you speaking of the second wave or a societal shift?
Second wave. I'm talking about the second wave in the Black community. I mean, the issue is that we have multiple generations living in the same home. We're more likely to be the essential workers. We're more likely to live in the inner city where there's respiratory issues or breathe the same air. We're not able to stay at home and say, you know what, I'm not going to that job. I got 9 months of savings. We have all of those issues that are going to be confounded by the virus. The virus doesn't discriminate according to race. But our situation is a situation in which we're more likely to get it and to receive it from others and spread it. And that's my issue, is that's why you see this high death rate in New York. They live in tenement buildings. Everybody's breathing the same air and they're having to go to work and bring it home to their families. A lot of our mothers are single moms and they're in these essential jobs. And if you lose the matriarch, what happens to the children? So this effect is going to be a ripple effect of us unwilling to do the things we're supposed to do. Understanding that pandemics are nothing new. Pandemics are in the Bible, which was duck down, stay low, stay inside your house, spread the blood of the lamb in front of your door and stay inside your home and wait for it to pass by. So pandemic, typhoid fever, all of these smallpox, all of these measles, this is not new. What's new is not doing the playbook. That's what's new. That we're not doing what we know to do. And now we lost that time when we had everybody's attention. And because people are restless and humans have to live. And the thought that we're going to sit in the house for 2 years and not eat is not going to work. That will create chaos, but you can do it safely. And we're not doing that. And that's what is frustrating. And I tell people as a physician, it's like being in a dream where you're being chased, but in the dream, you know how you're running real slow. The fact is that we can run a whole lot faster than this if we wake up out of this dream of denial and actually get to work and put the system to work. As Dr. Deepak is referring to, we can get the system to work and get people back to work, but our lack of doing what we know to do, it's like being on a great team and just watching us lose on the court. It just doesn't make sense that there is not a direction, there is not a plan, there's nothing that is being followed. And it's going to be to our detriment. And because it's only one by one death, it's going to be a while before we wake up and see the nightmare that did not have to exist.
I hope that we can get and understand those things that you're talking about that we have to put into the playbook. I believe we're talking about the rules of social distancing, the rules of some of the other things that they're talking about. But as you mentioned, some communities can't do that. If you're living in the tenements and you are kind of packed and you don't have the ability to spread out, then you're going to be impacted even greater. So that's a dilemma that we deal with. And that's what we're talking about also. Dr. Deepak, do you want to give a final statement and share with the audience what you feel on that?
Sure. So as my esteemed colleagues have said, and Brother Bishop and you have said, you know, this thing is horrendous. And as the government starts to open up America, it behooves each one of us to take responsibility for our actions and not be mindless. We have to be mindful and careful of our fellow human beings and take care of each other. You know, We've heard this before. Be your brother's keeper. Come on. We have to do this. Don't challenge yourself to do something stupid. It's up to us not to do so. We have to follow all the rules that are in place and take care of ourselves and take care of each other. We cannot rush. We cannot hasten here to rush and say, okay, everything's opening up, so it must be back to normal. No, it's not. It's never going to be normal again. There's going to be new normals that are being established already. And so we have to be careful. We have to look out for each other, and we have to be considerate of each other. We have to eat right.
I just want to interject this. I want to interject this. We're saying, watch out for our fellow man, love our fellow man, but then you have people saying, Governor Christie, he said, hey, people are going to have to die. Our own lieutenant governor, I forgot his name, but the lieutenant governor, he's making those statements. And these are people in high places. So it's going to be a challenge if we got people in those high places saying that. We understand about caring for our fellow man, but not everybody shares that sentiment.
Yes.
And that's the difficulty we're going to have.
That is true. That is true. And that's where
Go ahead, Dr. Deepak.
resources like you, Brother Baruti, come in. This is exactly why resources such as yourself and this show comes on. You know, what the lieutenant governor says and what those people say shows their character, their callousness. We can't be that. What they do is their problem. We have to do what's right and continue to educate our fellow human beings. No matter how we do it, whether it's this medium or other media that we use, we have to put the correct information out there. Not scare tactics, but correct information, real information that people can use every day, right? So I totally get what people in high places are saying, but my esteemed colleagues here, my fellow doctors here, we have to work hard. We have our jobs cut out for us. We have to do the education. We have to disseminate. Bishop Sanders has done the right thing. I mean, we just have to make choices as an individual citizen and get the word out.
Yes.
Yes, sir. Can you share how people can get in touch with you, Dr. Deepak, if they want to speak a little bit more? Remind us, please.
Yes, the best way to get a hold of me is to go to my website, texasyogainstitute.com, or Google my name, Deepak Kotecha, and it's easy to get a hold of me. And I welcome questions. I have no problem helping, everybody. So stay safe, people. Please follow the guidelines. Please follow all the rules for social distancing and hand washing.
Okay. Dr. Manera, Dr. Wilson, can you share how people can get in touch with you and a final statement?
Okay, so I just
Dr.
like
Manera?
to say that, can you hear me? Can you hear me?
Yes, go ahead.
Okay.
Yes.
Okay, I just like to say that stress and anxiety is not going to go anywhere. Stress and anxiety compromises the immune system. We want to make sure that our immune system is up to par, so you want to be cognizant of that. Okay, so my thing is, if you're going through something, say something. That's the best way to relieve stress and to deal with the anxiety. Somebody said coronavirus knows no boundaries, no socioeconomic or race. It has no boundaries. We want to be cognizant of that. And so again, if you're going through something, say something. Employee assistance programs out there, the companies, now that everybody's kind of locked down, even through the transition, they're offering EAP sessions. They used to offer 3, now they're offering up to 10. That's mental health or therapeutic intervention that's free of cost to those who are employed. For those that are not insured, you can use Medicaid, Medicare, most insurance plans, and there are a lot of provisions out there for mental health services for individuals who really need somebody to talk to. Okay, again, it's important that if you're going through something, that you say something. Okay. The other thing that I want to emphasize again is be cognizant of others when you're out there. because again, you don't know what somebody else is going through. So as we practice safe distancing and washing hands, we also want to be cognizant of other people going through things, not taking things so personal. And then we want to practice self-care, because if you don't take care of yourself, you can't take care of anybody else. And I agree with the Reverend and others who said we need to do some meditation. Don't focus so much on those things that we can't control, because the only thing that we can control really is us. And I think that if we do those things and emphasize those things and depend on the support systems that are available to us, everybody has somebody. Depend on those support systems, we all can get through this. And I'm not in private practice. I'm basically
somebody want to reach you
and training mental. Deborah, DEBORAH Wilson at MSN.com.
Yes, ma'am. Thank you very much. Bishop George, can you share how people can get in touch with you, my brother? Bishop George? Bishop George?
Yeah, let me just say this. Yes, let me just say this. We're going to get through this. I'm speaking as a part of the spiritual community. We're going to get through this, but I'm going to tell you now, it's obvious, it's apparent that something else is coming. And the way we get through that is going to be based on the effectiveness of how we handle the pandemic at hand. But we need to prepare ourselves, because something else is coming after this. So as everyone has already said, let's take care of ourselves. For those that would like to come to me for any type of anger management counseling, I also do parenting counseling, and I do spiritual counseling, and I can be reached at the same business number, which is 832-763-8342. Thank you.
And tell the people the name of your church, Bishop George.
My church is Greater Mount Carmel, the Church of Restoration, and my counseling service is Restoration Consulting Services.
Thank you, Bishop George. I would like to give the final word to Dr. Echols. Share and sum up basically for us, Dr. Echols, what is going to be the future? What's going to happen, as much as you can share, and give a word on how people can survive. Dr. Echols?
Yeah, we are preparing for people.
Hello, Dr. Echols.
Yes.
Can you hear me?
Yes, I can hear you. Can you hear me? Yes. Hello?
Yes, ma'am. I was asking you to give a final word on
Yes.
the future and the possibilities of what's going to happen.
Yes, well, I was saying that we are preparing for peaks of, or with the opening of the economy across this country. Doctors are preparing, the hospitals are prepared for new cases to come in. We're going to see the new cases coming in about 2 to 3 weeks from now of the opening of the economy. So probably around mid-June, we are preparing. We're already prepared. The CDC has prepared us to be prepared to go through the whole entire summer because of the opening of the economy. Let me say this, we don't want to sacrifice human life for opening the economy so quickly. And the CDC has a guideline. And I've been telling people to read the CDC guideline for opening up your business, your community center, your faith of worship. Go ahead and look at what the CDC is saying. It's very detailed, and you can look at it and put some things in place. So I even referred it to to my faith leader here in Houston. But we do have guidelines. I know that The leadership of the White House rejected those guidelines. I'm hearing that they rejected the CDC guidelines. They look over those guidelines, and that's what we're very big on prevention. And so I'm educating patients, wear your mask, and really letting them know why, the reason why it's important to wear your mask, so they can have a better understanding of asymptomatic carriers that are shedding this virus. Also, the hand washing is still very important. Social distancing, of course, and not being in crowded spaces. Also, if you are sick, do not go to work and do not go into your church. There are many, many people that will come to church sick. I know, because I take care of them at the church house sick. So, you know, don't come out if you're sick. And that's one of the things about society, that they have a rebellious spirit now. That's what I'm feeling like. It's a rebellious spirit. And that's why we're seeing so many people get sick. But I know we're going to get through this. I'm in agreement with the panel, with Bishop, is that God is going to bring us out of this. It's going to take time. We're going to have to put on patience. It's going to be our best weapon now. Take care of ourselves, take care of each other. But we are going to get through this, and they're expecting a vaccine next year. We don't know, but we're hoping that they can get a vaccine now. But remember, it's going to take a long time to vaccinate people. It's not going to happen overnight. The economy is not going to come back overnight. There are 33 million people out of jobs. It's going to take time for us to rebuild. We're like Nehemiah now. We're on the wall, and we got to rebuild, and we can't come off the wall until we finish rebuilding. So that's I'm at
Yes, ma'am. Thank you
Butterfly
very
Wellness
much.
at 281-5601. You can email me at butterflywellness1212@gmail.com or DrSabrinaButterfly.com.
Thank you very much. Everybody, we thank you for very important information. Hopefully somebody has got a better understanding and got a mindset to say, okay, I got to get down to business. I got to take care of business and do the best I can, because the pandemic is going to be here, but we wish to survive and we wish to move forward.
Yes.
This is the Soul Seeker Hour online. I'm your host, Rudy Carl Alexander. We are building and trying to work with a group of professionals to continue to talk about the things from the mental aspect, the things that affect us, the things that stress us out. And every month online, we're going to be talking about it. We did it in the studio. We're going to do it online. And this is the Soul Seeker Hour, and we'll be back next week. Bishop George will be hosting next week. We thank everybody for joining us. Bishop George, if you hold on, I'll talk to you in a second. But thank you, everybody. We'll see you next week.
Thank
the
you.
Soul Seeker Hour. Thank you. Bye-bye.
Bye-bye.
Thank you.
Bye-bye.
Bye.
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 Thank you.
Jordan.
Yes, I'm here.
Okay. Bishop George. Bishop George.
Yeah, I'm still
Do
here.
you hear me?
Yes.
Okay.
Yeah, can you hear me?
This is Jordan. Yes, I hear you, Bishop George. Bishop George, this is Jordan.
Okay, can you
He's working with us to make sure
Okay.
all of our things are okay. Jordan, this is Bishop George,
Thank
my
you,
partner.
Jordan.
Hello,
Hey,
Bishop
Can you
Jordan.
hear
George. How are
Jordan?
you?
Yeah, I can
Yeah,
Okay,
I think
I
there's a
see
little
him.
lag
Hey,
in the
Jordan.
video. There's a little lag in the video, y'all, but I can hear.
Okay. So Bishop George, we can help set you up for next week, and I'll share all the information with you. Jordan works with us to make sure. Hey, Jordan, how do you think the video went?
I think it went pretty good. I know next time we do it, we have to really make sure that Facebook goes through without a problem.
You know, I should
good.
have started the live earlier. That's what that was, because it takes a little bit longer.
Yeah, that's definitely a good idea. Is to start it earlier before you record. Maybe make sure that it's live on Facebook before you start recording.
Yeah, okay, that sounds good. I noticed everybody's bandwidth was low. Do you know what that's from?
So the bandwidth or the Wi-Fi connection, there's not too much that we can do about that. Honestly, it depends on the their connection, but also what kind of contributes to stuff lagging or kind of being fuzzy or just not exactly right is when everybody's microphone is on, which I know it's kind of good to have it on because you kind of get those little reactions of, yeah, or oh yeah, but in the long run, I myself think it's not good because that also contributes to background noise. And then also,
yeah, I heard.
Also when
Dr. Wilson had a lot of background noise. Okay,
yeah,
Jordan, can you, Bishop George, I'll send you his information. I'll be in touch, Jordan, and I'm gonna send you Bishop George's information so you can work with him and set up for him for next week. And the same deal for this week we got for next week. Is that okay? Jordan?
It's perfect. It's been my
sounds
pleasure,
great.
y'all, and it was a really good meeting.
Bishop George, you have something to
Thanks
say?
a lot, Jordan. Really appreciate that.
Okay. All right, guys. Well,
Absolutely.
we're finished.